Eating disorders take a major toll on the people suffering from them, but for people in Kentucky looking for help, it's not always easy to find it.
WDRB's Dakota Sherrick explains what health experts say is behind the problem.
In our state right now, there are 0 acute care programs, 0 residential, and 0 partial hospitalization programs. So anyone diagnosed with this illness that needs a higher level of care than outpatient, they are required to go out of state. That is their only option.
That lack of local access can mean dire consequences for the 900,000 people in Kentucky with an eating disorder, more than 29,000 of which are children.
Delays in treatment, the child is simply going to have a downward spiral. And that can be with worsening kind of behaviors and weight loss that goes with it. And so by the time they see me, they are near death. And so my job is to medically stabilize them.
Dr. Andrea Krause says in 2021, Norton Children's Hospital has seen a 2-fold increase in hospitalizations for eating disorders.
I would say that kids are sicker than ever. And I believe this is due to the lack of access and care.
She and other members of the Kentucky Eating Disorder Council presented this problem to the Committee on Banking and Insurance. They say insurance is the biggest reason behind the lack of care.
Insurance will not cover eating disorder treatment adequately.
This problem is something Dr. Sherry Levinson, executive director of the Louisville Center for Eating Disorders, knows all too well.
The situation that we've been running into is that we have been ready to offer a partial hospital program and open the first partial hospital program in the state. We've been ready for the past year, and we haven't been able to because insurance providers will not give us a sustainable rate.
Eating disorders require specialized care that costs $20,000 a month on average. The council says low reimbursement rates create a lack of providers, and the cost of out-of-state or out-of-network treatment is unmanageable for many in need of care. The council suggested legislative changes should include improving reimbursement rates and creating incentives to bring more providers to Kentucky. Time will tell if these ideas progress into law, but Levinson believes the conversation today marked a huge step forward in this issue. Dakota Sherrick, WDRB News.